being healthy means being younger. So anti-aging is equal to health. So in this section, we're going to be moving away from trauma and inflammation. Inflammation is equal to aging. Inflammation is equal to disease. Trauma is equal to inflammation, and therefore it's eventual aging. Signaling technology is the only cosmetic procedure that is not based on trauma. And what is signaling? It amplifies faded communications within and between cells. Now, let's understand that. What's that about? This is a macro scale, okay? So there's communications within our bodies, the way a city operates. There's cars, that people talk to each other, and so on and so forth. I can't turn this. There we go. So in the macro scale, there is a slide before that. Okay, so in the macro scale, there's communications within and between cells. And you can see here different communications under the microscope of how cells can communicate with each other and how cells can communicate within each other. So in the macro scale, the optimum functioning is when people are working together. It's what we were talking about earlier on. When people are talking together and they have meaningful communications, then everything is working well for the city. It's the same thing in the micro scale. Optimal neurocommunications, functional folded meaningful proteins, and we'll talk about that a little bit later, and it has to happen at appropriate times. If everybody talks over everybody else, nobody can understand what they're saying. It's the same thing here. Within cells and between cells, there have to be communications that are timely, that they are delivered within appropriate times. And this is what circadian clocks are, and the circadian clocks of the cells. And now, what is a circadian rhythm? We all know that you have to go to sleep at a certain time, wake up at a certain time, and that is a circadian clock of your body. So you have the midnight that you're sleeping, and then 6 a.m. that is awakening, and noon that you get hungry, and so on and so forth. There's the body works on a clock, and that's a circadian clock. Now, the cells are also have their own circadian clocks. It's a micro scale, so the body is a macro scale, and the cells is a macro scale. So every single cell in our body is controlled by its own circadian clock, and it helps every cell to help how to utilize the energy, how to repair DNA, how to replicate DNA, and so forth. And the several circadian clocks are located at the suprachiasmatic nucleus in the brain. And the brain is controlling basically everything, both the circadian clock of the body and the circadian clocks of our cells. Now, circadian clocks of cells, not our bodies, but of cells, has been associated with psoriasis. So recent studies have found that the skin circadian clock to psoriasis is one of the most common immune-mediated skin disorders. And disruption of the cellular circadian clocks works, it's also linked to cancer and other diseases. Somebody was asking me how our device works for psoriasis. You were asking me previously, right? The reason why is because we have created a timely projection of signals. And because the signals are in specific times that are compatible with the circadian clocks of the cells, That's why it works for psoriasis. That's why you see such a big effect of psoriasis. So let's look at this a little bit closer. The new technology that we have, iReVive and IELLIOS, is based on signals that are delivered within discrete times that correspond to cellular circadian clocks. That's why it had psoriasis. And here you can see a psoriasis skin, and this is the difference between that and the normal skin. And why the psoriasis skin can turn into normal? Because we readjust the circadian rhythms of the cells. So this is a study by Veronica Yap in Singapore. It's before and after of 10 treatments. This is severe psoriasis, and this patient could not, basically, she could not get an improvement with any other method until she got this particular treatment, and the improvement was significant. This is another case, again by the same doctor. This is before, and this is the after 10 treatments. The psoriasis has subsided significantly. And again, why is that? Because this technology gives into the body signals that are readjusting the circadian clocks of the cells. Now, the signals are resonant. They're based on resonance, and I'll talk about that in a minute, how that happens. And that's why they can be used for healing. So, key signals are delivered within discrete times, and they resonate with key biological signals that are involved in repairing the body. So the IELLIOS repairs the body step by step via resonance within discrete times that readjust the circadian clocks of the cells. So how does it do it? As you can see here, two signals can create resonance 1, but this resonance will create a bigger resonance, which is resonance 2, and it's amplified. That one is going to create a bigger resonance, which is 3, which is going to create a much bigger resonance, the 4, and an even bigger resonance, which is the 5. This is what resonance is. When one wave adds to another wave, they make a bigger wave. That's resonance. So one signal adds to another signal, making a bigger. Let me go back to the other slide beforehand. As you can see, this is like one wave adds to a second wave, resonance 2, to a third wave, resonance 3, makes it even bigger, to a much bigger wave that is done by resonance 4, and an even bigger wave resonance. This is 5 different waves added onto each other, making a much, much bigger wave that splashes on the beach with more force. It has to be two similar signals, like wave with a wave. But if you have, for example, wave, water, and oil, what's going to happen? Nothing. So it has to be, the signals have to be the same in order to be resonant. So that is the complexity and the difficulty of this science, signaling science, that you have to identify the signals and make them to be similar to the signals of the body. And now there has been a number of studies, actually Science magazine is full of these studies. Dr. Yogi was asking me, where is it? They're all on Science magazine. They are based on cellular research, and this is one of the studies here by Serial 2008 that showed under the microscope that resonance signals result in a rapid cell contraction and the subsequent cell spreading as observed by phase contrast microscopy. So the resonance signals from the outside get a very powerful response inside the body. And this is proven if you look at it under the microscope. This is another study on J&K signaling pathway. A signaling pathway is different signals that are combined and they make pathways, like you make roads, like roads, cars coming to different, like highways. Now, if you can downregulate the J&K signaling pathway, then you slow down wound healing. And if you upregulate it, if you enhance it by resonance, for example, what happens is healing will increase. And this is how you see the healing increasing. This is another, basically, you can see how the untreated is all separated, and here how the treated, you see that cells are connected together to make basically this. So this one is, if I can get it back. This doesn't work. Okay, thanks. On the left, you can see what the untreated is, where the wound is all open and it's all bleeding. And on the right, you can see how they've basically the hand has improved significantly. This gentleman was told that he will never grow nails after plastic surgery, and yet with the IELLIOS treatment, he did grow nails. And he gained full motility on his hand. This is within a week after 4 IELLIOS treatments. The same day, you can see the inflammation went down significantly, and then within a week that we gave 4 treatments, there was almost complete healing. This is very, very significant. This is done by Dr. Fiona Mack in Hong Kong. Diabetic wound, you can see after 6 treatments, this patient, she had wounds all for very, very long time that they would not heal with any other method. And after 1 year, the healing was complete and there was no recurrence. As you all know, diabetic wounds keep coming back and they never heal completely. Here, with this particular treatment, the IELLIOS treatment, after only 6 treatments, he healed completely and there was no reoccurrence. This is another study by Dr. Lampe. This is a post-cancer wound, and this is 6 treatments again, and you can see that some redness still. Obviously, she has to go through more treatments, but all the wound has completely gone. So it has completely healed. This is a necrotic wound after liposuction. Necrotic wounds are very, very difficult and never heal, basically. And here, the healing has already started. As you can see, this part has almost healed completely. This one has gotten much smaller, and this one has turned more live. And obviously, you would expect eventually the healing to take place in a complete fashion. This is again after the IELLIOS treatment. This is another diabetic wound from Cristina Preciado in Mexico, and only 4 treatments, a smaller wound, and it was complete healing. This is what you observe with aging under the microscope. What you observe with aging is this. This is a younger person, and this is how cells communicate with each other at a younger age, and this is how cells communicate with each other at an older age. So what we're trying to do is we're trying to increase the signals between and within cells to basically turn this into this. This is the goal of this technology, and we can do that through signaling. Now, examples of signaling technology is IELLIOS, iReVive IELLIOS, Ion Magnum, Virtual Gem, and we are really the only ones who have this technology. No one else has it. Signals resonate, and therefore they increase biosignals between and within cells. to result in cellular repair and regeneration. This is some rejuvenation effects. 2 IELLIOS treatments, you can see the difference on the eyes of this. The younger the person is, the faster it happens and the longer it lasts. This is a lifting effect. This is 4 treatments. This is a famous Chinese singer, Wang Wai, and she is absolutely in love with this technology. She's coming to all of our seminars and talks about it. This is another 2 IELLIOS treatments. As you can see, quite significant lift. This lady is much older. You can see the difference, but obviously she needs more treatments. Wrinkles completely disappeared after the IELLIOS treatment, just 1 treatment, and you can see this in a closer. This lady had a significant effect. You can see all of the wrinkles here significantly reduced. Actually, I can show it to you on my phone. You can see it even more significant. It doesn't show on the slide as well. This is for bumps under the eyes. That significant improvement, and also some pigmentation was improved significantly here. Pores, shrinking pores is another effect. Bags under the eyes, inflammation. This is inflammation. As you can see, there was a significant improvement on the inflammation, and also there was lifting. Clinical studies on hands. This is again from Dr. Lampe with all the veins. That's the before and the after. I have another lady that I did yesterday on her hand with a new technology that is more powerful. And anyone who's interested, I can show it to you later. It was right here in the show. Now, pregnancy masks for postpartum care. This technology is fabulous because it really gets rid of pregnancy masks very, very fast, sometimes in 1 treatment. Decreased pigmentation. Now, this is ovarian cancer severe chemotherapy side effects. I have the video of this lady that gives a testimonial. The pigmentation and the wounds on the hands significantly subside. That's by Dr. Fiona Mack. Another effect on pigmentations comes from a study from Dr. Pock, clinical study. Stretch marks is also has a significant effect. Sometimes it does take more than 1 time. Of course, if the stretch marks have been there for several years, it might take 6 or 7 or 8 times. But there is an effect, significant one. There is a decreased inflammation and energy increase by special programs designed for Dr. Mark, and she utilizes this for her patients. Other skin conditions like inflammatory conditions like acne and rosacea, significantly better after 1 treatment. This is 6 treatments from Brazil, another clinical study on severe acne, cystic acne, that has significantly improved. This is a burn on a baby's arm from Argentina. From Argentina, and you can see the burn here on the baby's arm, and within 4 treatments, it was completely healed. Varicose veins, we don't have we have a lot of reports of varicose veins that it works, and also on hair loss, there is 1 clinical study from Cristina Preciado that does increase hair. Now, a lot of studies we have had on pain, a lot of studies. Dr. Mack has a clinical study, acute back pain confirmed to nerve compression on MRI, failing physiotherapy and told to have surgery for compression. This gentleman had 10 treatments, and then after 10 treatments, he could walk and move with ease. Hearing impaired immediately by 30% improvement. That's another study by Dr. Mark. And this is how it's done. And you can also, you're welcome to come to the booth and watch how it's done as well, if you're interested. This is what it looks like. That's the IELLIOS. And this is the new upgraded device, the iReVive, that comes in several languages, including Indonesian. Now, how does this work? And let's imagine how does this work. Can anybody tell me, can you unboil an egg? Once you boil the egg, can you unboil it? Anybody? You say no? You say no? Who else says no? Who says yes? Okay, well, science says yes, and it's a Nobel Prize winning science that tells you that yes, you can unboil the egg, and all you can actually do is you actually fold back unfolded proteins that were unfolded by the egg being boiled. So yes, you can unboil an egg. And yes, you can reverse aging by folding the proteins that have been unfolded. And this can also be a beginning that can lead to better cancer treatments. This is the press release on the DNA repair from the Nobel Prize. And this is how a misfolded protein is associated with disease. And this is a different conformational, so all you have to do with the proteins, if there is a way to get them to fold again through resonance, then there can be a reversal of illness and a anti-aging effect. And this is that's a nonsense protein. You can see this in a kind of more in the letters, how it stops and it's not complete. And this is a full-length protein. This is what it looks like. And this is what a full-length protein looks under the microscope. So what we do here, remember this, that is stopped and it's an unfolded protein. And this is the message that it gives a nonsense message. And by replacing parts of these messages with the resonance from the outside, with the iReVive and the IELLIOS, what we do is we basically helping the system regain all of the letters. So basically, this doesn't make any sense. This one says alternating frequencies forming a biolanguage. And this is what iReVive is and IELLIOS. Now, neurofrequency transmission it happens through ultra low energies. So how basically do you get it into the skin? And you get into the skin with proprietary, very low energies, or via voltage-driven signals. The first one is the IELLIOS, the second one is the virtual gym and the iron magnet. I'll speak about it in a minute. And this is how they go through. This is a cell, and this is an ion channel, and this is how the signals can go through the ion channel. And at certain energies, these ion channels are amplified. There's a book that was published in 2008, Electron-Gated Ion Channels, is full of mathematical equations that actually proves that at certain specific energies, the ion channels of the cells open up, and then you can pass through signals, and those signals can resonate with the signals of the body at discrete times, specific times, and therefore reverse the aging process, or create healing of wounds, or help pain. Now, there's also voltage-driven signals, basically like vaccination without needles, that you have a gun and you kind of get the vaccine through the skin without the needle, through the voltage. We can also send signals. And it was originally developed by the co-inventor of the pacemaker, Jerry Pollock, and he created it for multiple sclerosis. And this is how he did it. Basically, he had a normal neuron and a damaged or atrophic neuron, and he utilized a technology that was added to the atrophic neuron to create a neuron that was basically normal again. And this happened through resonance. It took him 17 years for the first signal to be created, and 27 years for the signals that we have today in the virtual gym. A long time. But he did it by hand, trial and error. It's a technology that's made by hand. There's nothing digital about it. It has to be unlimited resolution, and that's why it has to be done by hand. So this is the body we all want. And of course, there is fitness is equal to health. Everybody knows that. And not having big meals and not being fit is going to end up making you ill and shortening your life. And the question is for you, gentlemen, to exercise or not to exercise? What do you think? And for you ladies, to exercise or not to exercise? What would you like? And here, we can have something that can happen without the exercise, at least to jumpstart your fitness. And the problems with exercise is that it's effort consuming and time consuming. And if you're older, you're gonna break your back if you're trying to do a lot of sit-ups. So there is basically a risk of injury with age. So the solution is what we call the virtual gym. It's the upgrade of the Ion Magnum. And it comes in different colors, and it's fabulous. We call it Energy Intelligence Matrix or Motor Nerve Intelligence. And this is how it's done. And it basically burns up to 5,000 calories. If you come to the booth and try it out, you're gonna lose up to 6 or 7 cm. Well, that is actually more than 5,000 calories. So one treatment is you get full 4 seconds contractions that last for 4 seconds each. So that's basically is like going to the gym and doing up to 1,000 sit-ups, quite a lot of sit-ups. Now, what happens during the treatment? What happens during the treatment is that a series of signals, remember we were speaking about different signals adding onto each other, like waves adding onto each other. Here you have motor nerve signals adding onto each other, and they eventually reach the brain. So what happens under the pad, you send the signal, the pad spreads the signal to the motor nerves spread the signal to the motor nerves neighboring to them, and those motor nerves to the other motor nerves neighboring to them, and it's a waves and waves of signals that are adding onto each other to eventually reach the brain. Once it reaches the brain gets on exercise mode and starts releasing hormones, and it's the hormones that burn the fat as an energy source to actually build the muscle. And here what you have, active exercise, it stimulates the motor nerve, that stimulates the pituitary. The pituitary sends out thyroid growth hormones. Thyroid hormones become T3 to T4, and lipolysis burns the fat as an energy source. Growth hormones turns into IGF-1, and that is involved in the muscle building. And you also have a DHEA that increases bone density and collagen. That's why you have this rejuvenation effect, even though you're just doing a treatment on your body. Your face looks better. This is the virtual gym results on MRIs. And as you can see, this is the only technology that can work on visceral fat. No other technology can do that, no lasers, no radiofrequency, no other technology can actually help remove visceral fat other than this particular technology. And this is the results of the study. As you can see, the MRI showed a significant decrease of visceral fat, and the significance level was 0.01 below probability 0.0. That's 1 in 100 people will not get the results. That's extremely significant. And what is visceral fat? This is what visceral fat is. As you can see, it's the fat that wraps around the organs. This is a heart from a visceral fat condition. As you can see, this person is not going to live very long. It's basically it's going to shorten his life as a result of visceral fat. Visceral fat cannot be removed by laser, radiofrequency, plastic surgery, or even the gym. Why not? Because it's extremely strenuous, and when you're older and when you're young, it's fine. Yeah, you can deal with the visceral fat, but when you're older, you can build the muscle, but this gentleman here who's older, you can see he has visceral fat and he has built the muscle on top of the visceral fat. So even the gym is not going to get you, it's only this technology that can get you to remove the visceral fat. Even the gym is not going to get you that. This is one of the studies. After 6 treatments, he was done with the iron magnum. This is actually Wang Wai. She's the famous singer that I was showing you before with the face results. She had quite significant effects, completely in love with this technology. This is another study before and after. This was done with a smaller device, the 8-channel device, so it wasn't as powerful. I'm going to show you some results with a bigger device. This lady from Poland did her dissertation in Warsaw University with the iron magnum, the 8 channels one. And this is some results on after 15 treatments from India. And this is the actual results of the study. As you can see, in sonography reports, there was fatty liver, there was no evidence of fatty liver. We have seen this with a few clients. If you do a sonography report and before the treatment and a sonography report afterwards, you're going to see that the fatty liver will no longer be there. Lower back pain with significant decrease in back pain. This technology is fantastic, especially for muscular pain or torn ligaments. Of course, there was a reduction in the fat content, and there were several inches lost. But the most important thing, diabetic status also went down, so it does help diabetes as well because it burns the blood and the sugar. Dr. Yopi was asking me, how come I like sugar and what, because it's so dangerous. And I said, oh, I got the machine at home, I can burn the sugar in my blood, no problem. This is 20 treatments, and again, it was with the iron magnum, the larger machine. And this is the measurements of this lady. As you can see, triglycerides, significant decrease from 294 to 197. Insulin went down from 136 to 14, and insulin fasting in 25.8 to 8.7. And so the back pain also was a significant decrease in back pain, but there was increase in good cholesterol. So that's all of these results are significant, and the fat content also went down, and of course, her weight was reduced significantly. And this is another case. As you can see, this is the measurement from here to here. This lady had some effect. She might need more treatments. Now, muscle mass has also increased significantly in studies that we've done with MRI. And this is the MRI study. This is the MRI study, and again, the subcutaneous fat and the muscle mass were significantly increased. Subcutaneous fat was decreased at the 0.01 significance, and the muscle mass was increased at the 0.01 significance. Again, that's 1 in 100, that's a very significant result. basically most people had a very high result here. That was another case study. They just measured inches and weight. The weight went down about 11 kilograms, and um, fat content went significantly down, and you had quite a few inches lost. This is another study by Dr. Margaret. She did a dissertation in Poland University. This is a study from Myanmar, as again with a bigger device, but older devices. This was done in Hong Kong. Dr. Lam, I did this treatment. It was like a 20-minute treatment. This gentleman lost about 5 cm, then 6 cm on his, around his belly. This is 2 treatments by Ali White in Utah. Actually, this is the before. She did it incorrectly. And the other one is the after. This is also 14 inches by Ali White. This is one treatment with the iron magnum genius, the 8 channels from Dr. Locke. And this is from Puriforma, Dr. Jopi's clinic in Surabaya. And we did this with a virtual gem. It was a significant reduction of this lady. And as you can see here, there was another significant reduction. This is after 20 minutes in our booth. As you can see the difference. I don't know, it doesn't look as, I don't know why the slides are pulled out somehow. So the slides are not looking properly. They're pulled, you have pulled out the slides somehow. So anyway, it's far more. I have to show you the pictures in my phone. Now, postpartum care is also quite significant with this technology because it does a very powerful detox. The detoxification is very, very important. It has about 10 waveforms that do detoxification at the same time that has 10 waveforms that do visceral fat burning. So what you have here is you have a very powerful detox that happens simultaneously as the fat is burned. What happens when the fat burns? The fat contents are released into the bloodstream, but it also release toxins. The toxins interfere with metabolism. So everybody who has tried to lose weight has found out that you reach a ceiling effect and you cannot lose any more weight. Am I correct? So what is that? Because the toxicity interferes with your metabolism. It also interferes with sex hormones and gut hormones. So the powerful detoxification of this technology can help with the weight loss very significantly. Now, also another effect that it has is breast lifting, which is not something that you can do with any other technology. And it also does from the sweating. You know, if you have night sweats with postpartum care, then that is something that can be helped with this technology very significantly. So it's fabulous for postpartum care. Incontinence, we have done a study in United Kingdom in 2008. The technology was certified for incontinence, and it was based on 10 sessions that were received without diuretics, and the incontinence was significantly improved. So the technology has been certified as a Class 2 device for incontinence in the UK.
Excuse me, Ms.
Energy levels also are improved, and also the sluggish and moodiness would also significantly improve with this technology. And this is something actually that earlier clinical psychologists like Wilhelm Reich said that all psychopathology and all illness is the result of blocked energy. And therefore, when you release the energy, which is what this technology does, you will reduce both psychopathology and also you will reduce mental illness.
Excuse me, Ms.
Now, this is the ISO. Thank you, please. This is the ISO certificate of the Iron Magnum. And this is the CE mark certificate of the Iron Magnum. And it's FDA cleared. I did the clearance, so as you can see, my name is there. This is the certificate, the ISO certificate for the IELLIOS. And this is all the certification of the IELLIOS. It has FCC, it has the CE mark, DAF, EDV, it's highly, all this safety agreement. Now the conclusion, what this technology does, it does biorepair, and it does fitness, and it does health. And we think that this is true anti-aging. IELLIOS Health Builder, Virtual Gym, are a paradigm shift away from trauma to a signal-based technology that includes biorepair and fitness and health, which is anti-aging. I would like to invite you to our booth, and we can demonstrate the technology to anyone who's interested, and you can see for yourself the significant results of this technology. Now, this is the international ongoing research, and this is all the doctors that are involved in this research. It's international. You can see Hong Kong, Japan, Europe, Canada, USA, India, Japan again, myself, Singapore, and Dr. Yobi in Indonesia. Thank you very much.
Thank you very much for your presentation. Is there one question and answer? Maybe from the audience, is there any questions? For two or three questions? Yes? Is there any question from the audience? Or everything already clear? Maybe you all can visit the booth, yeah, and see how the IELLIOS work, yeah. Ms. Xanya will be there. Okay, then thank you very much and for your nice presentations. Yeah, and this is a big appreciation from us. Okay, now we come to the next